So inflammation, what means inflammation? Yeah, we're talking about what means inflammation first. Inflammation is the local reactions to something injured there. We say something could be internal reason cause, could be external reason cause. When we talking about stimulating there, we're still talking about something injured. Something injured. So that's still reactions to the injury. So that's inflammation. Inflammation is the local reaction to the cells or maybe to the tissues injury. So that means inflammation. That means inflammation. So we say pathology. We're talking about the first aspect is what's caused. Yeah, what's caused. So basically, inflammation, we can thinking about that's the injury for the tissues because we're talking about locally, the same similar cells together that form the tissues. So that's basically we say what's caused the inflammation. Pretty similar like what's caused the illness. Yeah, still similar. Still, physical reasons, just the injury, just the physical injury there, or trauma, pressure, or maybe temperature changing, that's possible can cause, like some people burning itself by the hot water or maybe hot oil. That's just temperature changing. That's a physical reason. And then locally will have inflammation. Radiations can cause. Chemicals can cause. Like a toxin or maybe stronger kind of acid can injure the local skin and cause the inflammation. Some bacteria can cause virus, fungi, pathogens can cause like a local infection in there. And the immunity disorder can cause. When we're talking about immunity disorder, basically, we have three aspects. But low immunity is not directly cause local inflammation. So that's basically it causes like other pathogens easily evaded, cause the mainly problems is the pathogen caused, maybe some organ disorder. But hypersensitive reaction that can directly cause, especially autoimmunity. They like immunity against the tissue or cells itself. And certainly we still including immunity deficiency here. So immunity disorder can cause. And still some genetic reasons or metabolism disorder, that's like some people have diabetes, still can cause. So that's some reasons we're talking about cause the inflammation. Pretty similar like we're talking about cause of the illness. So that's generally we're talking about inflammation. Generally talking about inflammation. Inflammation happens possible acute one, possible chronic one. They are a little bit different. So generally speaking, when we're talking about inflammations, we're talking about some reactions with the cell or tissues injured. So we say inflammation, including acute inflammation, including chronic inflammation. Acute inflammation. So that's basically some reactions, especially in early stage, immediately reactions, like basically is some fluid go to there and plasma protein go to there, and certainly some cells go to there. Neutrophil cells, that's white blood cell. That's white blood cell. So when we're talking about inflammation, we're talking about other cells injured or tissue injured. During a pretty short time, immediately some reactions happen. So like we're talking about a short time, maybe just a few minutes, everything reactions already. And then they can keep few hours to few days, some changing in locally. So that's acute inflammation. Then let's see what's mainly a big difference, like a normal tissue and after tissue injury, the reaction to it. So this side is the model of the normal tissue, like a normal small artery coming from this side, small vein go away from this side. Normally we have some cells in the tissue. Middle part is the capillaries. It's not belong to artery, not belong to vein. But after inflammations, something triggered the inflammation, caused the local injury in there. So what happens, you can see the picture here. The firstly, increase the blood flowing. You can see blood vessels dilate here. And even in the capillary area, even in the vein area. And secondly, some liquid and blood protein coming out from the blood vessel. And the third step, some neutrophils, more white blood cell coming out from the blood circulation. You can see the model here. They can moving from the blood vessels to outside of tissue. So now you can see more cells in the locally. So that is the basically simple picture when we're talking about acute inflammation. So acute inflammations, we go to another picture. So basically pretty similar like the last picture. Above part is like some normal kind of situation. So during normal kind of situation, or fluid is circulation. Some fluid go out from the blood vessels, and some fluid absorptions. And the yellow color here means plasma protein. So plasma protein truly like keep the fluid go back or holding the fluid in the blood circulation. And some pressure in the blood circulation is moving the fluid go outside. And some pressure in the tissues pushing the blood back to the blood circulation. So that's normal. But when abnormal kind of situation happens, like we talking about blood vessels dilate and the local blood increased. So firstly, just some liquid go to outside, and later on, even some protein coming to outside. So that happens in the acute inflammation. So we have 5 basic signs for acute inflammation, like clinically. What will be happens for acute inflammation? The firstly is redness. Because we're talking about blood vessels dilate. It's tiny small blood vessels dilate. So that's basically bring more blood coming from local, and even some blood cells migrate far more like blood vessels go to outside of tissues. And also when we say damaged tissues, it is also possible damages some blood vessels. So that's another reason red blood cells go to locally and cause the redness locally. Second signs for acute inflammation, some heat. So basically after injury, immediately people can feel some heat in the locally. Or maybe if we're touching local tissue, we can find local area is more heat. That's still because blood flowing increased. We know the temperature in the blood circulation is a little bit higher, about 1 degree higher, compared with the tissues or superficial of the body. So generally say, our internal bodies is more temperature, little bit higher temperature. Our superficial body is less temperature. So that's more blood flowing go to locally. Truly, they bring more heat to the locally. So that's the second symptoms or signs. And the third symptoms or signs is swelling. So we're talking about inflammation. It's local problems. So locally swollen there. Because blood vessel dilate, then we say firstly some fluid coming out. So they originally coming from the blood circulation. And go to the space between the cells and the cells. Then they make it swollen there. So that's basically is more fluid coming. Because during that time the blood vessels is easily allow the fluid coming out. So that's the word we use, permeability. Permeability just means the fluid is pretty easily coming out from the blood circulation. Then we talk about locally painful. So these kind of painful, possible part of them caused by physical reasons. We're talking about some stretching and some tissues, inflammations, edema, and even sometimes some parts under. So that's pain can cause by like a physical reasons, removing the structure of the muscles or tissues there can cause pain. And another reason, chemical reason. So like we see before, during the acute inflammation, some chemical intermeters will go to locally. So we have a lot of chemicals intermeters. It will be go to locally. So that kind of chemical intermeters can cause the pain. And the last aspect for acute inflammation is losing function. So basically, if the part of the tissue is injured and then losing functions, basically is caused by the painful situation, by swelling, so like we talked about before. So that's people couldn't move it, yeah, and not like to move it. But truly, if the swollen there and if painful there, thus people don't moving locally. It's kind of protection for the people. So like some people injured ankle, just don't walking. It's easily with healing later. So that's basically we're talking about. We have 5 basic signs with acute inflammation. So when acute inflammation happens, they have early reactions and later reactions. Like immediately reaction is early reaction. Basically, it's blood vessels reaction. Like we talking about blood vessel dilate. And the later reactions basically is the cells reactions. Most cells go to locally. Then we're talking about some detail here. we say early reactions is the blood vessels reactions. That will be immediately happens, but they still separate with a few steps here. So the first step immediately is the blood vessels contractions. We say acute inflammations. It causes the blood vessel dilate. But the first reaction is the blood vessels contraction. So that happens pretty fast, like just injury, like just seconds. Then blood vessel will be contracted. So these kind of contraction generally say, like if we cut our fingers there, some blood coming out, but pretty faster blood stopped bleeding. So that's just because there are blood vessels contracted there and less blood coming out. So that's the first reaction. So these kind of blood vessels contractions is triggered by some nervous system reactions or maybe some chemical reaction. So that's the first reaction. And secondly, blood vessel dilate. So that's basically blood vessel dilate, increased blood flowing, go to locally. So that's we talking about like later on, local some heat in there, and the local more swollen in there. That's because blood vessels dilate. And we say increased blood flowing, blood vessel dilate, certainly increased blood flowing go to locally, but they slow blood flowing. So we can thinking about some river. For example, we have the same amount of the water coming. If the river is narrow, the blood flowing is faster. If the river is more wide, the blood flowing is more slowly. So that's the idea. Basically, blood circulation in the system is the same amount. Now it's locally dilate blood vessel here. So that's blood flowing in there is slower. And when blood flowing slowly, it's easily caused stasis locally. So that's basically it happens locally. And also some protein coming out also. We see from the beginning mainly is the fluid. And then some protein coming out also. And certainly later on, maybe some blood cells will be coming out also, because blood stasis blocking inside where the blood cells go, they will go to outside. So that basically happens. Yeah. And then some chemical mediators will be coming. So that happens during acute inflammation, some steps there. So that's the first part. We're talking about acute inflammation, early stage or immediately reactions for the blood vessels, contraction first, then dilate, then some chemical go to locally, blood flowing slowly, then go to cells reactions, is the later stage. When we're talking about the later stage, still not too slow, maybe just like hours or 2 hours. Yeah. But blood vessels reactions is just a few seconds or few minutes. So cells reactions. So basically the cells will be go to locally. That we talk about migrations, rolling there and attaching there, and then some white blood cell, leukocytosis, will be go to there. And go to local area, go to injured local area, then they will performing their functions. Clear some passengers or kill some passengers and clear locally. So that's the cells reactions here. So that's white blood cell, whatever, they rolling or go to there and then coming back, attaching and then coming back, coming out of blood vessels, then go to local area, like we have some like bacteria there or maybe virus there. So you can see like they make a covered first, then digested. Yeah, this one is eating some passenger already, then digested. Certainly, during these sections, we have a lot of chemicals like helping with the cells to kill the passengers. But that's generally say basically reaction in there. So chemical, yeah, go ahead. This one or this one? This. Oh, kind of like connect each other and cover local area. Yeah. Yes. Right. Yes. You're right. Yeah. Just talking about how they go to locally with the way they touching, and then they go to there, and then they perform their function later. Yeah. So that's the rolling. And do we have pitching here? Yeah, we don't have special pitching here. But whatever, they just the way they go to local. Yeah, go to local. We have some chemical mediators during the inflammation. So these chemical mediators, so basically they react pretty fast. Like just the cell injury locally, and immediately some chemical mediator will go to locally, and then they triggers acute inflammation. like we're talking about like blood vessels reactions or maybe the cells reactions. So that's medical chemical mediators is pretty important part. So that's originally inside of our blood vessels and circulation with the blood. Some chemical mediators just in the tissue. But when some injury happens in the tissues, or maybe some injuries damage blood vessels, they will immediately to release some chemical mediators. So that's we talking about during inflammations, blood vessels reactions, cells reactions. But first step, chemical mediators, it will trigger the blood vessel reaction and the cells reaction. So that's basically picture about acute inflammation. So that's we're talking about during acute inflammations, like something injured cells. After cells injury, the first reaction is chemical mediators. The second reaction is the blood vessels reaction. Then the third reaction is the cells. So that's some chemicals is trigger acute inflammations. Then we're talking about some benefits during acute inflammations. So acute inflammations process, we're talking about firstly some chemical go to there and then mainly is sterilize the blood vessels. And a lot of fluid or liquid go to local area. So that's basically is like relieve less toxins in the local area. So whatever is triggers inflammations. So possible some chemical, possible some bacteria or virus, they will relieve some toxins in the local area. So by the inflammations, we say some fluid go to there, and even later on, some cells go to there. So that's truly make locally toxin is decreased, like a percentage of toxin in there is decreased in there. So that's the first benefit, relieve some toxins. And the secondly benefits, we're talking about some antibodies can go to local area. Antibody truly is protected of ourselves. So that means when blood vessel dilate, when the liquid go to locally, and the same time they can bring some plasma protein go to locally. So plasma protein, including some antibody, just some protein. Usually they will circulate in the blood systems. It's part of the plasma protein. So now liquid coming out from the blood circulation go to locally. They will bring the antibody go to locally. So we say antibody that can directly against the pathogen, against the organism. So that's the second aspect. And then some fibrous formation. So what means fibrous formation? So basically, originally this kind of fibers still coming from plasma, still coming out from blood circulation. That's one kind of plasma protein. Normally, they circulation with blood circulation in inactive kind of form, like pretty smoothly moving. But something triggered, they will go outside blood vessels and they can change the shape. And they can connect to each other even. So what's that working for? So that working prevent bacterial binding. And also able to like the white blood cell, it's more killed passengers locally. So that's another benefit. So we still have some more benefits. So some other benefits, we say plasma coming, protein coming, and also some chemicals coming. So basically they go to local area and like prevent more protection in the local area. And later on they will prepare to healing. So next class we will talking about healing. So last class we talking about cells injury. This class we talking about like a tissue injury. Tissue injury, local injury, we call inflammations. And some other benefits, because some cells go to locally, moving from the blood circulation to the locally, certainly they bring more nutrition to the locally. So when cells healing, they will need more nutrition, like glucose, that's the single sugar, like oxygen. So that's basically more nutrition can come into the locally because more blood flowing go to local, and some cells more easily go to tissue. And certainly some other nutrition like minerals also can go to locally. And they also easily remove locally waste products. So that waste products mainly removed by the lymph system, by the lymph channels. But lymph systems, lymph channels circulation finally still go to blood circulation. So it's totally depending what kind of waste product. Like the bacteria, like a dead bacteria or even living bacteria. Through the lymph channels, they go to lymph nodules first. In the lymph nodules area, we have a lot of cells in there. Lymph cells, they can kill the bacteria. But some other waste products, they may go back to blood circulation and finally release from the kidney. So that's another benefit. Locally can give more nutrition and remove more waste products. And another benefit for acute inflammations is promotion the immunity functions or stimulation the immunity functions. So that's generally we're talking about microorganisms or pathogens. So that's like they have some toxins, maybe internally carry, maybe externally can release. So that kind of toxins, we say, can go to follow the lymph systems, go to lymph nodules. That we just talking about some waste products can follow lymph channels circulation, and some microorganisms can follow the lymph channels circulation. So they will trigger lymph systems or stimulation lymph systems, cause the immunity reactions, and then generations more antibodies, and also some immunity systems cells. So that's truly make our immunity systems more stronger. So that's some other benefits coming from inflammation. So look like inflammation is not a bad thing. Yeah. Just local swollen there. Maybe some redness in there or even painful in there. But we have a lot of benefits from the inflammation. Truly, everything has benefits. They may have some harmful effects. Yeah, everything has two sides. Like we learn TCM, we talk about yin and yang, two aspects. So some bad things also happens during acute inflammations. So what's the bad thing? Tissue will be injured or damaged. So that's the mainly things. Like inflammation after cells injury. And then, so like some locally tissue will be dead. Necrosis, which is used from last class. That's the cells dies, yeah, tissues dies. So that's basically coming from the cells or tissues injury. So then the tissues will be necrosis. And the necrosis itself is more trigger inflammation locally. Another one is not truly good for us. It's swollen, locally swollen. So that's basically, if we're talking about in the lymph part, it's not a big deal. They just swollen. and maybe painful, which is not use it. That's still kind of protected of yourself. But truly, if acute inflammation happens in special part of the body, like we talking about inflammation happens in the epiglottal stones. So where it is. So basically, it assaults anterior part of our trachea. So that's our air passing route. Post part is esophagus. And we especially have cover there, cartilage cover there. So usually, normally this cover is opened like this way. Thus allow the air passing through. And truly, like under it, we also call voice box here. Voice box usually still open. Thus make some space air can passing through. But when we speak, that's multiple kind of in there. Sometimes open, sometimes close. Close just temporary. If you're looking from the top part, it's like this. So when inflammation happens in this area, especially. So that means originally they have some space between it. Now it's swollen. It connects to each other. So what happens? People difficult breathing. So severe kind of case, people possible die. Thus, maybe you heard about some people just got flu and then suddenly die. What happens there? So basically, it's swollen, especially blocking or air passing the route go to the lung. Certainly, if people no air go in, no oxygen go in, they will immediately die. So thus we say acute inflammation mostly is beneficial for us. But if they are in the special location, still possible severe kind of situation will be happen. Another kind of situation, we talk about meningitis, and some inflammation happens in the brain. So that's our brain area is totally covered by the bone. We only have some open or connection part in lower part of the brain stem connected with the spinal cord. That's the space, like we have hole in there, truly not bone in there. Other part totally covered by the bone. So that's when meningitis inflammation happens in the cover of the brain. And maybe inflammation just happens inside the brain. Both these two kind of situations, we're talking about acute inflammation. What happens? Firstly, blood vessel dilate. More blood go to locally. More liquids coming out from the blood circulation go to the tissue. Make the tissue swollen. When swollen happens in the limbs, we can see the swollen there. But when swollen happens inside the brain, they don't have space to go because all is covered by the bone. So truly pressure inside will be increased. What will be happens? The pressure inside will be increased. Upper part being is high pressure, they pushing everything down because we talk about the only hole in here. They pushing everything downward. So that can immediately cause people die because that area is our medulla oblongata located area, like our anatomy talking about. So that's our respiration center located area and the circulation center located area. So that area put to this hole and the pressure in there, that's truly blocking blood supply go to local area and truly cause the local nervous cells die. So that's another severe kind of situation possible happens for acute inflammation. So acute inflammation, we say mostly without benefit. But for some special conditions, especially swollen in special area of the body, they may cause the most severe kind of disorder. So that's basically. And also sometimes some reactions maybe not totally like a general reaction, maybe got some inappropriate reaction, still possible for acute inflammation. So that's generally acute inflammation. Then we're talking about the cause of acute inflammation. Means after acute inflammation happens, and what will be happen? So acute inflammation could be ending up totally recovered. Totally recovered. So we say they can totally recover like a normal tissue, normal structure, and recover normal functions. Like people have pneumonia. After pneumonia, they totally tissue recover. So that's the first possible. And the second possible is kind of healing, but it's healing by the scar tissue. It's not originally a tissue there. So that means they recover for the shape, but not recover for the function, because different cells, their function truly is different. And the scar tissue mainly is the fibrous inside. Fibrous don't have special cells functions. So that means locally, for example, on the superficie of the skin, like we have injury here or damage here, then it healing. Then like acute time, they swollen, they redness, they painful, and later on they gradually it's healed. But they have the scar tissue here. But we know our skin mainly is epithelial tissue. Epithelial tissue is protected over cell. But during epithelial tissue, we have like some sweating glands in there. When people got hot, they can sweat in there. And we also have some nerve bunch like go to there. Like if we put a needle there, people can feel painful. They also some nerve branch can feel the temperature changing. So like if we touching our skin, we know the temperature changing. But right now, in the scar tissue area, they losing all the functions. They just shape, they just shape the skin there. Most scar tissue will you can see pretty clearly. Most little bit below the skin level. Some of them little bit bigger than skin level, but whatever, they losing normal function of the skin. So that's the second possible. Yeah, first possible is we expected. Second possible, still okay, not bad, but truly they're losing some function. The third possible, they form some upset. What means they form some upset? Basically, local cells is dead and pass inside. It is possible covered by the thick fabric in there. Certainly, cell size, they losing function locally. So that's the three possibles after acute inflammation. They may ending with. So for the healing part, we will talk about next class. Now we're talking about chronic inflammation. So chronic inflammation is long-term problems. So that's basically what means chronic. Weeks problems, months problems, or even years problems. So pretty long time problems. So during that time, the inflammation is still in there, not totally healed. And the tissue will be damaged. And also the same time, some repair or healing process happens. So that's chronic inflammation. It's not only the time, but just for the time, like injury and repair happens same time. So let's see, what's the caused chronic inflammation. Chronic inflammations can cause by different reasons. With the infections can cause the chronic inflammation. But these kind of infections, it can cause only by special kind of microorganisms, like a special kind of bacteria, or maybe special kind of fungi. A typical case is tuberculosis. Tuberculosis bacteria, they specially cause the tuberculosis. So that's basically mainly it's chronic inflammation happens in the lung. Like some area of the lung, they got inflammation. So usually, if lung got inflammation, we call it pneumonia. But for tuberculosis, we are not directly call it pneumonia. It is still inflammation happens in the lung. But pneumonia, usually we name it for acute inflammation happens in the lung. For chronic inflammation happens in the lung, and especially caused by tuberculosis bacteria. Thus we call tuberculosis or TB. So TB kind of patients, they can for months or years. They pretty slow development. Always in there. People chronic cough, tired, sometimes sweating. So poor appetite. Sometimes cough with blood. So that's if we looking locally lung, that's some inflammation there, some repair in there. That's chronic in there. And the similar situation, some fungi is easily caused chronic inflammation. So that's basically we say this kind of organism is a low toxin. So that's why it takes so long time to develop. So other immediately cause pneumonia. That's more even stronger toxins. And also sometimes it may caused by some, we talk about some chemicals or some materials that can cause the chronic inflammation. Like some toxins go to blood circulation and then attaching for the blood vessels there, then can cause some inflammation there. And they may be coming from acute inflammation. Acute inflammation, we say mostly they will be ending totally cured, and maybe ending by the scar tissue, or maybe some abscess formed. But that's ending. Some acute inflammation maybe not ending. They changing to chronic. So that's chronic inflammation. And also some immunity disorder. Autoimmunity disorder can cause the chronic inflammation, like some special kind of arthritis and systemic lupus. So that's chronic inflammation. So that's we're talking about some chronic inflammations. They may have some cause. So chronic inflammations is a little bit different with acute inflammation. Acute inflammation, we're talking about like a cell, blood vessels, and chemical mediators. In chronic inflammations, it's mainly the cells. we have two special kind of cells can go to locally for the chronic inflammation. So these two cells originally still coming from the bone marrow. And these two cells, like it's kind of protections for our bodies. Like some passenger go in and they will eating the passenger. So that's the same cells we talking about eating cells. So they go to different part of the bodies. We may name it with difference. So that's some name in the liver and maybe in the spleen, lymph nodules, the name is different. But their functions is the same. Functions is the same. So the function is cleaning cells of the bodies. And certainly during chronic inflammations, they try to clearly locally for the inflammation in there, for some dead cells in there, or even some bacteria in there. They try to performing the cleaning. So that's the mainly cells, during chronic inflammation. And we have some other cells also in chronic inflammation. T lymph cells. T lymphatosis. T lymph cells. So that's some reactions during chronic inflammation. So that's belong to our immunity system cells. Immunity systems cells. We have T lymph cells. We have B lymph cells. Belong to our immunity lymph cells. And the B lymph cells also go to chronic inflammation. So both of them. So B lymph cells can producing antibodies and can against pathogens directly. T lymph cells, similar like we talking about eating cells, they can against pathogen directly. And we also have some other cells can go to like a chronic inflammation and also some allergy reaction. So allergy reaction locally, we're talking about like changing some tissues shape in there, still belong to chronic inflammation and the parasite. So chronic inflammation, we say we can like separate with two types. One type, no special state of chronic inflammation. So that's just generally, some cells go to there, like we talked about before. So that's for some chronic process of inflammation, especially with kind of some acute inflammation and then changing to chronic inflammation. like chronic inflammation happens in the gallbladder. And it usually is some fabric tissue inside, beside the cells. And another kind of chronic inflammation with a special fake kind of inflammation. We even give it a special name. So what that means? So just like a picture here, so the inflammation especially, they will form in some shape like some new coming cells. It's some auxiliary cells in there. So these kind of cells, mixed with other cells we talking about before, is kind of healing process in there, but not truly healing. So that's the process, chronic infections, inflammations, and with the process, with the healing, and especially with auxiliary cells in there. So that we call it especially kind of chronic inflammation. So in this kind of process, truly happens in some special kind of inflammation. We say not all the chronic inflammation belong to this special kind of inflammation. They only happen in some special kind of bacterial infections, like we just talking about tuberculosis, and maybe some sex kind of infection, sex illness bacterial infection, and some special kind of fungi. Not all the fungi infection. Special kind of fungi can cause. And special kind of parasites can cause poison. Special kind of poison. And we're still talking about special kind of microorganisms. And also some special kind of toxins it can cause. And also some other reasons, like some toxins, some acid, and cirrhosis, that's the liver issue. Chronic liver issue caused all the liver kind of fabric changing and some chronic inflammation in there. So that's we have a lot of reasons cause this kind of disorder. But remember, the cause is special for it. Yes, specially. It's not all the bacteria or fungi or chemicals or parasites can cause chronic inflammation. Just a special kind of bacteria, fungi, or maybe parasites, or maybe toxins can cause. So that's a chronic inflammation and the cause. Then we talking about generally like a body reaction for the inflammation. We talking about a local reaction before, like a local redness, painful, swollen, and feel heat. Now we're talking about the body reactions. Yes, systemic. Yes, systemic just means the whole systems, whole body. Infections, further inflammation. So generally say, when we talking about here, including acute inflammation, including chronic inflammation. So just general inflammations, the body reactions. The first reaction is fever. We say fever itself, like a temperature changing, to kill some microorganisms, pathogens. So that's the first reaction when people got inflammations. People possible have fever. So usually acute inflammation, people got high fever. Like suddenly happens, people got high fever. So usually over 39 degrees. Sometimes people even can go to 40 or over 41 degrees, pretty high fever. Immediately reaction. That's our body, the way protected of ourselves. And chronic inflammation usually is low fever. We say low fever, still fever. Yeah. It's not a low body temperature. Yeah, don't confuse it here. So that's we say normal body temperature is about 37.3 degrees or even lower than it. Yeah, 36. That's basically still normal. But low fever is about 37.3 to 38 degrees. Low fever. So that's chronic inflammations, like we talk about the TB kind of patients. They always have low fever, especially in the afternoon. They got a low fever. And the morning, maybe body temperature is normal. But going afternoon, they got fever. But not high. But if patient got acute pneumonia, that's usually like suddenly happens. They're high fever. So that's the first reaction is fever. And then we're talking about second reaction, the body. Endocrine systems may have some reaction. Metabolism will be getting some changes. So that's we're talking about endocrine systems. We have glands, and the glands secretion hormones. So we have some glands, especially adrenal glands, will release some hormones, especially working for acute inflammation. That's mainly. And the metabolism changing, that's usually like people getting more sweating. Certainly when people get a fever, they will sweating more also. And nervous systems will have a reaction. So that's still the way protected of ourselves. Like auto nervous systems make the heart beat faster. So in this way, they can send in more blood to the locally. And they also increase like a body temperature. And some other reactions, we say it's possible patients' behaviors will be changing. Like people easily angry when they go to like infections locally. So that's some mental disorder. So mental behavioral response also possible caused by the fever. We say when people got high fever, they may like get crazy kind of conditions. And then what's changing in the blood? So some situations will changing for the blood cells, especially white blood cells. The number, most case, increase the white blood cells number, especially neutrophils. Yeah. We say we have 5 different kinds of blood cells, but the neutrophils is about 70 to 80%. That's neutrophils. Especially in acute inflammation, the red blood cells, especially neutrophils, the number will be increased pretty fast. And the possible decrease the number of the white blood cells. So that's for some special kind of inflammation. Sometimes most happens in chronic inflammation because long-term chronic inflammation and they use lot of white blood cells to against the pathogen. So when acute inflammation happens, body reactions relieve or producing more white blood cells, relieve to blood circulation. But chronic inflammation, like long term, they use big amount of white blood cells, and their producing functions couldn't catching or matching up with the use. So thus the white blood cell will be decreased. And the patient also could be weight loss. So weight loss still mainly coming from chronic inflammation. Long term, like affected body's digestive functions and all the nutrition to build up some cells to against the pathogens. So that's basically it will be happen. Especially we talking about TB, chronic infection. So TB kind of patient is pretty thinner, or pretty poor nutrition. Yeah. So that's usually long-term disorder. Like just acute problem, just few days, maybe not effective. But if the like about a week or 2 weeks, sometimes still cause people losing weight. But after acute inflammation, their body weight can coming back pretty soon. But for chronic inflammations, their body weight pretty hard to come back because the chronic inflammation is pretty hard to totally cure it. So that's basically for today's class. So today's class we talking about inflammation. That means locally some tissues injured by different reasons. And chronic inflammation can cause by different reasons. So still pretty similar, like we say, cause of the illness. And chronic inflammation we separate with acute inflammation and chronic inflammation. Acute inflammation, that's basically reaction of the tissues, happens immediately. Some chemical intermeters there, and then cause the blood vessels dilate. Then some cells go to there and cause the locally redness, heat, and swollen, and painful, and losing function. So early stage, basically blood vessels dilate and the liquid go to locally. Later stage, mainly is the cells reactions. So we have some benefits and harmful effects for the acute inflammation. And the acute inflammation ending up totally healed, or may be healed by the scar tissue, or may be formed abscess. If acute inflammation is not healed, there are possible changing to chronic inflammation. But chronic inflammation not only changing coming from acute inflammation. They possible caused by other reasons, like some special kind of pathogen infection. They can directly cause chronic inflammation. And some chemicals can cause the chronic inflammation. And some immunity reactions can cause the chronic inflammation. Chronic inflammation mainly is the cells reactions. And we have different cells go to chronic inflammation. And chronic inflammation we separate with two different types. One type we call it no specific. Another type we call it specific inflammation, or we call it granulomatous. So that's the same thing. So that's basically during these chronic inflammations, they have special kind of epithelial kind of cells in it. So that's why we call it specific kind of inflammation. So special kind of inflammations only caused by special kind of like bacteria or fungi or parasites or toxins. Not all the pathogens cause the special kind of inflammation. And when inflammation happens, we call it's local reactions, but not limited in the locally. They may have some other symptoms, like a whole body reaction to it, maybe fever, maybe behavior changing, maybe metabolism changing, maybe blood cells changing, or maybe body weight loss. So that's for today's class.